Hello everybody, this is Dr. Vuong, Director of Bariatrics at Loveless Bariatrics in Albuquerque, New Mexico. Congratulations on your weight loss journey. If you're watching this video, then you're ready to start the Optifast 800 calorie meal replacement program. So this is a quick short video you can watch and continue to rewatch on how to take this Optifast product, okay? The purpose of the product is to shrink your liver and get you ready for surgery. I need to be able to access high up into your stomach area to give you a perfect baby, all right? And you also have to shrink the fat and the omentum around your stomach. That way, I can really see what I'm doing. So here's how you're gonna take the product. It's really simple. I hope you're taking notes, all right? So if you are, here's the first thing you wanna write. It's 5 servings a day, no more than 4 hours apart. 5 servings a day, no more than 4 hours apart. You can also follow along on the script that we've given you also. 5 servings a day, no more than 4 hours apart, plus all the water you can drink. And that's it. You need to think of this not as a punishment. This is not a punishment. This is a vacation from food. You have no food choices to make while you're on the Optifast product. It either has to say Optifast or water. And if it doesn't say that, you can't have it, all right? Now, don't go around writing Optifast on top of your tacos and lasagna. That doesn't count. You have to take the Optifast product, all right? And 5 servings a day, no more than 4 hours apart. Now, I want to teach you how to do it. So, what is a serving? 1 shake equals 1 soup equals 1 bar. And you can have any combination of that you want. One time I had a patient, all she wanted was 5 chocolate shakes a day. That's all she wanted. She was absolutely not going to make any decisions. All right, total vacation from food. I think that's kind of boring, so we've given you a variety of products that you can choose from. But as long as it says Optifast and water, you're good to go. All right, so 5 servings a day, no more than 4 hours apart. Now, how do you take those? The shakes, literally, you're gonna just shake the packet, pop the straw in, and that's it, okay? Now, you want your shakes cold. They don't taste good at room temperature, so refrigerate these. If you forget to refrigerate them, you can pour them over ice, and that'll cool them down. All right, so you want your shakes cold. You can also, if you have a NutriBullet or NutriNinja, one of those products, you can blend the shake with some ice, and it'll make you like a chocolate Wendy's Frosty. Don't ask me how I know it tastes like a Frosty, but it does, okay? Now the soups come in 3 flavors. Now what you want to do with the soups is you want to get the water boiling hot. It's really important that the water's boiling hot. Then you're going to pour the water into the soup packet per the instructions. And then you want to take a whisk and you want to beat out all the lumps. That's key to enjoying the soups. You got to get all the lumps out. You can put it in a blender if you want to dirty up a blender, but most people just use a whisk. The key is that the water needs to be boiling hot, okay? Now, after 2 years of living in New Mexico, I finally realized the answer to the question in your head right now is yes. You can put chili powder in your soups. You can put any herbs or spices in your soups. No salt, please. Optifast is perfectly balanced for salt and sugar intake, okay? So any spices you want, curry powder, chili powder, Mrs. Dash, anything you like, as long as you'll take the product, okay? Now the bars. You also want to order a bunch of bars. The bars are for convenience, all right? So there's nothing to do it other than just to open it up and eat it, all right? So buy a bunch of bars, put them in your purse, take them to work with you, put them at your desk, put them in your locker. For my patients who travel a lot from out of town, put some in the glove compartment of your car, because you'll thank me if you get a flat tire and you're waiting for AAA to come help you, and you'll be like, oh my gosh, thank goodness I have a bar in my glove compartment. So these are very convenient, all right? It'll also give you something to chew. Drinking shakes and soups, you miss the sensation of chewing, so definitely get some bars, all right? Any combination of these products, as long as you're taking 5 servings a day, no more than 4 hours apart, and you're golden, all right? Now, what's a schedule? Let's think of a schedule. Let's say you wake up at 6 a.m. The first thing you need to do is drink some water. From now on, the rest of your life, when you first wake up in the morning, you have to drink water. Why? Because we dehydrate when we sleep. We snore and that sort of stuff, and you have your CPAP machine on, and so you'll dehydrate. So drink some water. Then you need to take a serving when you first wake up. So a bar is very convenient, or a shake. So you take a serving at 6. Then you'll take a breakfast serving at 9 a.m. You take another serving. At noon will be your lunchtime serving, okay? At 3 p.m. will be your afternoon snack serving, and then you can have your dinner time serving around 6:30. That's when most people are sitting down to dinner. Now your family will be sitting down to pizza, and you get your Optifast. I know they're rude. I know you know it's your family. All right, so that's a very simple schedule. It's the face of the clock: 6, 9, 12, 3, 6. All right, but Dr. Vuong, what if I wake up at 7? If you wake up at 7, you just rotate that clock by an hour. So you do it 7, 10, 1, 4, 7. That's it. Dr. Vuong, what if I sleep until 9? It's the same clock, so don't panic. All right, so that's how you'll take the products. No more than 4 hours apart, so that's a 3-hour schedule. It works really nice, okay? Next, what should you do if you get hungry? The first thing you need to do if you get hungry is drink some water, all right? Just drink some water, and because a lot of times our feelings of hunger is actually dehydration. It's actually more thirst than hunger. So the first thing you do if you feel like you're hungry is drink water. The second thing you're going to do is do some activity. If you're still hungry, get up, do some activity. Stop watching the television. You're probably watching commercials that has like food products and stuff and it's making you hungry. Leave the house for a little bit. Your husband's probably reheating that fried chicken and it's just driving you nuts. He's such a jerk, but you married him. All right, so go for a walk and go sweep the porch, go work in the garden, go walk the dog, go do something, okay? So you've drank water, you've done some activity. If you're still hungry, you want to take a 6th serving. Doesn't matter, soup, shake. But Dr. Vuong, it's only been 2 hours. It doesn't matter. It's a psychological game. Just take the 6th serving. This is really important for the bigger patients. If you're tall, big tall men, or a bigger patient, you might need a 6th serving. Remember, 5 servings is only 800 calories. So 6 serving is only 960 calories. And it's a psychological game. So go ahead and take that 6th serving. Do not eat food. This is a vacation from food. You could be good for 13 days or 20 days and then say, screw Dr. Vuong, I'm going to go have a buffet the night before surgery, and your liver will re-expand. So don't do that. We want your liver nice and small, because if I get into surgery and your liver's too big, guess what? I don't do your surgery. I close you up, send you home, and what do you get to do? You get to redo the Optifast. Problem with that is you don't have a baby, and you might get a bill from the hospital because they did their part. And you might get a bill from anesthesia. They did their part. So you do your part, stick to the products. This is a very simple way to take it. All right? Next number, if you're taking notes, Optifast is a natural diuretic. What does that mean? That means you're going to be going to the bathroom and peeing every couple hours. So drink more water. Also, the first 2 or 3 days while you're on the Optifast product, you might feel like you're having the flu. Very common. You're going to maybe headaches, neck pain, body aches. You'll be lethargic, kind of dragging around, but just tough it out, and you'll be fine in a couple of days. Okay, you're not coming down with the flu. It's just your body getting used to 800 calories. All right. The next number, medicines. Now, I said that Optifast is perfectly controlled for salt and sugar intake. So, if you're a diabetic, you need to check your blood sugars, because if you're on insulin, chances are you're going to have to be off your insulin. So you've got to be aggressive and weaning yourself down off your diabetes medicines. So don't, just check your blood sugars 4 times a day. And if it's getting low, then just start to decrease your insulin, okay? And you might even actually be off of insulin completely before surgery. That's one of the cool things about this product. It will also, because there's no impurities in it, you're going to be diuresing. Your blood pressure is going to get better, all right? So you need to check your blood pressure. If you're standing up and you're lightheaded and dizzy and your blood pressure is 80/60, you need to skip your blood pressure pill. If you have any questions, call your primary care doctor or call us here at the clinic, okay, when it comes to your medicines. All right, next number. Optifast is the best energy you'll ever have. Why? Because you're getting rid of a lot of the impurities that dragged you down. It's perfect sugar balance, blood pressure balance, so you're going to feel great. Optifast is also the best sleep you'll ever have. Why is that? It's because you're still going to be a kick-ass mom, kick-ass dad, teacher, employee, but now you're doing it on 800 calories, right? So if you get tired at 8 o'clock at night, guess what? You need to go to sleep. That's what you need to do. Do not watch another episode of Walking Dead, okay? Do not do another spreadsheet. Just go to bed, and once your head hits the pillow, you will sleep really hard, and you'll wake up at, boom, 6 o'clock and be like ready to take on the day, right? So best energy, best sleep, all right? Next thing, since you're not chewing food, the bacterial flora in your mouth is going to change. So you want to brush your teeth after every serving of Optifast. You really want to brush your tongue, get that protein powder stickiness off your tongue. You can also use sugar-free gum. You can also use like sugar-free breath mints, like little Tic Tacs. All right, but take a toothbrush to work. Have some toothpaste with you at work, in your purse, etc. Just brush your teeth after every serving. And that's it. You know, that's how you take Optifast. 5 servings a day plus all the water you can drink. It's actually very simple. Just set your alarm on a schedule and to beep and remind you. And after you get past those first few days, it'll be piece of cake for you. All right? This is an exciting part of your journey. If you put your mind to anything, you can achieve it. So you can achieve anything for a couple of weeks. But also remember, you're going to be in Optifast for a week after surgery, liquids only. So find a shake or soup you like. And this is an exciting part. You know, it's just one part of your journey. So excited for you. Thank you very much for watching. Feel free to watch it again to keep taking notes and remind yourself. All right.